Namaste and welcome. In this short practice, tailored for when it really hurts in the back, we'll incorporate a chair. I also covered my sticky mat with a blanket. And I place another blanket here for my head. You can use a pillow. You can also just lay on your carpet, a nice thick carpet. So this floor would be too hard. We are telling the body, it's going to be okay. I'm going to take care of you and I'm going to help you heal. That's the message. So this practice is intended to help release pain and to get the body out of the fight or flight response, which often just creates more tightness, there's more pain. So beginning to switch that around so the body can come into a place of healing. Placing your hands on the lower abdomen. Let the breath be easy. Breathing in through the nose. And I will breathe out through the mouth. Take a breath in. And exhale. Breathing in and out. And we'll repeat. Breathe in through the nose. And exhale through the mouth. Big sigh. Squeezing all of the air out. Do that one more time. Now, as you breathe in and out through the nose, just the belly rising with the in-breath, and softening down on the out-breath. When we breathe in this manner, the main muscle of breath, the diaphragm, is doing the work. It's how our bodies were intended to move. But often if we are in pain, we shift into shallow breathing, mouth breathing sometimes, and the diaphragm doesn't move. And when that happens, the psoas muscle, connecting same place as the diaphragm and to every vertebrae in the low back, tightens and tightens and tightens and tightens. And that is often the cause of low back pain and all that follows from that. So first, we want the diaphragm to do its job, inviting the psoas to release. So if you are in acute back spasming, back pain, the best thing you can do is breathe. Breathing with the belly, in and out through your nose. And that may be the entire practice that day. To continue, we will draw the right leg into the chest, hugging it in. And as you inhale, we'll release it back onto the chair. Slide, draw the left knee in. Releasing that on. Just getting the body to connect. Let's do the right again. And you can hold it in if that feels beneficial. Let it stay for a little bit. trusting the wisdom of your body, moving slowly so not to cause yet further contraction or spasming. Do one more time on each side. And then we'll take both knees in. Plugging both knees in. And maybe rock a little bit from side to side. This helps open up the back of the spine. It creates a little bit more space between the lumbar vertebrae. They can get really jammed together. We'll release the feet back onto the chair. Take a breath in and out. So each one of these practices that we're doing right now, they can stand alone or all together. Like I said, for when it really hurts, a little goes a long way. The next practice is gentle arch and flattening. So I invite you to place your hands again on your lower abdomen. And breathing in, belly expands. And breathing out, the belly relaxes. Now on the next in-breath, belly expands again. And as you exhale, draw the belly button down towards the spine. So the belly pulls down. You feel it moving away from the palms of your hands. And then slowly release. Take a breath in and out. And we'll go in the opposite direction. As you inhale, invite the muscles on the low back to contract. And we're going to come into a little itty bitty arch. So the back lifts up a little bit now. We're asking these muscles that may be spasming to contract and slowly release back to neutral. Take a breath in for nothing. And as you exhale, we're going to flatten again, draw the belly down, hollow out the belly. And then slowly release on the in-breath back to neutral. Take a breath in and out. And inhale, arch again. Now we're contracting the muscles on the low back. Getting a little bit more blood supply into the tissue. That's what we need for healing. To help them release. Now slowly, slowly, slowly floating back to neutral. A little bit more length. Breath in for nothing. And exhale now, flatten and again contracting the lower abdomen. Pull it away from the hands. This activates your inner corset muscle. Slowly release. Let's take a breath in and out. And we're going to do that one more time. Inhale, arch. Muscles contract on the low back. You can feel it. And then slowly release. So if you encounter pain, more pain as you do this, back off, back off, back off. Sometimes we initiate, but we don't execute the movement. But we begin to get movement on the muscles that supports the spine so they don't just hang out, that are dead away. We need to re-educate them to do the job they were designed to do. Breath in for nothing. And exhale, flattening. Pull the belly in and up. And releasing to neutral. Easy breath. We'll draw the knees in again. hugging them to the chest. Rock from side to side. To encourage a little teeny bit of rotation. And this your back may not be ready for this, so this may be for another day. Just letting the knees just gently go to one side and then the other. Not a big movement. Not a big movement at all. And if your body's right away saying, nope, then respect that. There's always tomorrow. As you come back to center, hugging the knees in again. Now holding on to the knees as you inhale and arch. And exhale, draw the knees in maybe a little bit tighter. Inhale, arch. Knees pulls away, they can't go very far, there's a chair there. And pull in again. And let the head just move along. So as you arch, the chin draws to the chest. And as you flatten, the chin lifts up. Just go back and forth. Easy, gentle effort, but no strain. And we let the feet again come back to the chair. Take a moment and check, am I comfortable? You can use your couch, comfortable chair, an ottoman. It doesn't have to be a yoga chair. It's just whatever allows your legs to rest in this position. That puts the psoas in a slack position so that they can give you a little bit more space. So we bookend it now with our breath. Breathing in and out. Belly expands. And relaxes down on the out breath. It's like a gentle wave lapping up on the shore. And then disappearing back out into the ocean. We create space. Pain contracts. Ease expands. The pain can become all-consuming. So part of the practice is simply to invite in space. Space for not being in pain. You can stay here as long as you like. When you're ready to return, draw the knees in, and then very gently find your way over onto one side. Pause. Fast jerky movements, again, can cause the psoas to say, what? Then we move slow, and that you'll use your arms and hands, but also draw the belly in and up as you begin to sit up. That supports the spine. Thank you for allowing me to share this super short practice for when it really hurts. Namaste.